Hey everyone. Gage, should we dive in or is Mary O'Leary on her way?
Um, I think we can give it maybe another minute or so. Give her
I don't
some
know, the
time.
New Haven Independent's on time, so maybe we can give them a little scoop before Mary arrives.
Paul, I'm sure it was a good birthday gift to Tom to not have to cover this today.
Yes, yes, it was. Believe it or not, I bet he would have wanted to, but we were firm about the day off when he worked till 5 in the morning covering the vote. Yeah,
I thought we were,
really.
I thought we had a tough time deciding things in New Haven, but the state capital, man,
Oh wow,
you sure
five
took
in
it.
the morning. They
Yeah.
almost four.
Well, let's dive in, and we can fill in others who show up later on. We just, and I'd like to do this a little bit more regularly. I know that we were doing this almost on a daily basis previously, but it's helpful to check in from time to time. I think the main focus of this update today is going to be on COVID again, but happy to answer any other questions as well. We're up to 2,833 cases with 114 fatalities. And I'm just going to share the overall numbers and trends. You've probably seen, just seen the people on this call, you've probably seen this graph and others before. And this is the breakdown of COVID positive cases over the entire length of this pandemic in New Haven by race, ethnicity, and location of cases around the city. This is people that have tested positive. This is hospitalizations. And this is COVID-related deaths. And I was looking at a comparison to, I think the last time I did one of these graphs and breakdowns was about a month ago. And the overall trend has not changed significantly around the demographics, at least with race and ethnicity, who are impacted with COVID-19, and also the regions around the city. A few other updates. As folks know, there's a travel advisory that the governor has implemented, and now there's 34 states that are included in that travel advisory. Important for people to get the word out that individuals that traveling to those states are required to self-isolate when they return to Connecticut for 2 weeks. And that's for very obvious reasons, that our cases remain low in New Haven, and to keep each other safe, in addition to the mask wearing and social distancing and other protections. It's very important because there's a lot of hotspots around the country that people are responsible if they do travel to those spots, and when they come back, don't put others at risk. On that note, we have some slight changes to the testing schedule around the city, and I'll give you some updates here. And we're also updating our website, the COVID-19 testing website that the city has. The Strong School that is on Orchard Street, as folks will recall, Yale New Haven Hospital is moving what was their Sergeant Drive testing site to the Strong School site. We finalized an agreement with them, and they are now working to do some slight physical changes to the site and to activate the site soon. Not quite active yet, but it's very close to being ready to go. Yale New Haven Hospital is also operating, or starting to operate, 2 other sites. One is at the Walgreens parking lot on Whaley Avenue in the Amity area on Fridays from 10 a.m. to 3:30 p.m. And then the other is at Ross Woodward School on Saturdays from 10 a.m. to 3:30 p.m. They have multiple RVs that they're using, they recently purchased, they're using for mobile testing for the region, including Bridgeport and also these sites in New Haven. We also continue to have Murphy Medical doing testing on the green every Wednesday from 8 to 4. And at the Chapel and Day Street site, Mondays and Thursdays from 12 to 5. And of course, the two community-based healthcare centers, Fairhaven and Cornell Scott, who are operating the same as they did before. Lighthouse Point, we are implementing some restrictions to Lighthouse Point, limiting the number of vehicles that can park there, and also restricting it to Connecticut-only residents. So that will begin on July 31st. And then for shelters, we've had a number of isolation shelters over the period of the pandemic. Albertus is now closed. We had been using Albertus as a site for individuals that needed to self-isolate and didn't have the infrastructure or a home to go to self-isolate. Our agreement with Albertus ended, or is to end, on July 31st. And because we haven't had the need for that in the last several weeks, we've closed that site. We're working on and have some leads on identifying another site to accomplish the same goal. On homelessness, as you'll recall, there have been hotels that we have collaborated with the state and our local partners to rent for individuals experiencing homelessness to not have to go into congregate shelters. And there is one hotel and 90 people left in that hotel that are individuals experiencing homelessness that are using the hotel so they don't have to be in congregate shelters. Over the course of the virus, community partners in the city have cooperated to house, of the individuals that have participated in this hotel program, 266 individuals, which is a huge feat. And kudos to our partners that have been working very hard to identify permanent housing for those individuals. 266 people is a lot of people. And even outside of COVID-19, that's a significant challenge. There's a lot of evidence that shows that congregate settings for the vast majority of people is not the most successful way to end homelessness, but getting people into some sort of permanent housing can help them address many, many other issues as well. And so I'm proud of the work that our team has done to get us to that point. Why don't I hand it over to Director Bond to give an update on nursing homes and any other COVID-related updates you have. And also if you could share a little bit of an update on the overdoses as well.
Absolutely. Thank you, Mayor. And so, as you know, we continue to monitor the positive cases in our city. I always try to make a disclaimer that the data is fluid and it's provisional and is continuously changing. So today, I just want to report on our nursing home side, we're seeing the numbers are stable, 0 positive cases, and 0 reports on deaths. So we are really pleased to see that. So there's no significant reporting on this. And so we will continue to monitor and work with our nursing homes. What we're currently doing in collaboration is monitoring and doing an assessment of their current PPE burn rate and ensure that we can provide support to the different nursing homes. And so our team continues to do that. There's also a stabilization amongst their staff reporting. And so that's also good news. And so we will continue to, of course, monitor and report any changes as needed, but really happy to see as the overall cases are relatively low, we're seeing the same in this specialized group, and we will continue to support as we prepare for any potential surges and just making sure that we're prepared to respond to this particular group. In addition to tracking nursing home cases, as you know, over the weekend, we reported some of the concerns in regards to overdoses in our city, and also an advisory that was published by the Department of Public Health by the High Intensity Drug Trafficking Alert System, also known as HIDTA, informing us of a drug that they have been monitoring in surrounding states called the Gray Death. A gray death is a combination of different synthetic opioids that is a gray-like matter and looks like a rock. And so they're suspected that it has entered our state overall. And so we have been advised to closely monitor that. And so we have been doing that in conjunction with the Department of Public Health, our fire department, and our emergency management director to sort of assess where we are. Daily, we've been getting alerts both on a county and local citywide, and are seeing that we are below the threshold of 22, which is good news. We are not seeing any clusters, which is also good news. However, we are seeing that there's some reporting of overdoses happening throughout the city and throughout the county. Right now, we're seeing 15 cases of case definitions among 3 females, ages 26 to 32 years of age, and 12 males, which is consisting of about 20s to 59-year-olds. That's really aligned with the dichotomy that we were seeing historically in the last 3 years in regards to overdoses of the 2 different age groups of concerns. And so that continues to remain consistent. And we will also continue to monitor. Most of the cases were between New Haven, East Haven, and Waterbury, with the greater number being Waterbury. So we will continue to update you and the community. And what we're trying to do is to ensure that as a city, we are being responsive. And so we're working on a number of efforts. I did report this throughout the weekend, but I just want to sort of talk a little bit about the fact that, number one, this has been declared as a national public health crisis. So yes, we're in a pandemic, but we're also dealing with this public health epidemic of opioids, and we want to be responsive as a city as well. There has been some Connecticut legislation that has been passed around this with the Good Samaritan law, and so we want to make sure that we're working collectively with our local partners, as well as making sure that people have access to treatment. So in New Haven, we're going to be working on a couple of things. We're going to be working with conjunction with hiring a dedicated full-time community health worker that will provide support with identifying hotspots in our city. We're trying to work with our community services administrator, Dr. Dalal, to standardize our data reporting, as such as the one that the mayor just reported, on really looking at where our hotspots are so we can have really targeted outreach in the community. We also want to work with our local providers in doing peer-to-peer video campaigns so that we can be able to provide support to those in recovery and be able to provide supports that still need to get into treatment, so that it can be peer-to-peer education of real stories of those in recovery, and also providing a repository of local resources. We see that there's resources available at 211 and at the state website, but we want to have a local specific repository here and be able to work with our local partners and the coalitions that are working and are committed to this cause as well. And so that's sort of what we're looking to do. We're also going to increase Narcan training in our city so that we can make sure people have access to Narcan kits, and as well as continuing to work with our local providers on doing training around the prescription laws and ensuring that they're registering to that national statewide registry, a state statute that passed 2 years ago. And so those are some of the things that we're going to be working on in conjunction with that. And Brooke Logan is the point of contact at our health department, 946-6999 if you're interested in joining these efforts. If you're a local provider and if you're in need of help, please call 211 right now for some local resources that can be available to you. And I'll turn it over back to the mayor.
Thanks, Director Bond. Dr. Vasquez, you had some information to share about a grant.
Yes, thank you, Mayor Elicker. So the New Haven Health Department has received notification just earlier this week that we were selected as a building local operational capacity for COVID-19, or more easily, Block COVID-19 awardee. And this grant is a collaboration between the CDC and NACCHO, the National Association of County and City Health Officials. This one-year grant for $100,000 will allow the health department to hire 2 nurses to work with our team on COVID-19 infection prevention measures with community partners. And it will also allow us to establish a COVID-19 task force with these community partners. We will be reaching out to our community partners within the next few weeks to discuss this partnership further. And this will be beneficial in addressing gaps during this pandemic recovery phase, as well as for planning for future surges. We're excited to be the recipient of this grant, and we look forward to building these partnerships as we work on COVID-19 efforts.
Thanks, Dr. Vasquez. And I know the Independent reported on this, but I just wanted to remind people of something that impacts a lot of people in New Haven's lives, and that is the change in our street sweeping policy. It's really important to get the word out about this because it is a significant change. We are no longer going to be towing people if their cars are in the way for street sweeping. The previous program would, someone that left their car on the street on a street sweeping day would get a $50 ticket, and then would also have to pay an $89 towing fee for $139 total. And if they left the car at the tow yard, they'd also get storage fees. In order to reduce the financial impact and annoyance to residents, but also to continue to incentivize people to move their cars, we're increasing the towing ticket fee from $50 to $100, but not towing. And so the overall cost of the resident, if they don't move their car, goes from $139 to $100. And we believe people are likely to move their cars. The street sweeping will go around cars that have not been moved, and cars will be ticketed. I prefer that that residents aren't putting oodles of money into tow companies and don't have to chase their cars across town on street sweeping days. And we think this is a win-win for everyone. It'd be great if the press could help us get the word out about it, because since we've done this policy with towing for many, many years, it's important for people to know about the change. I think that's all we got to cover, right? Unless I'm missing anything, team, are there any questions? Go ahead, Paul.
Hi, Mayor, just 2 small follow-ups. You said you're gonna be changing the numbers at Lighthouse for how many cars? How many cars?
I think it's 225. Director Bond, is that the current number? Is 225 is the max?
Correct.
And we'll be doing enforcement of zone parking, I'll say aggressive enforcement of zone parking around the park, because there's been a lot of people that park and then walk in, and we've gotten a lot of complaints from residents about that.
Great. And then Dr. Vasquez, congratulations on your grant. I was wondering, what are some of the, as you talked about how you're going to have 2 nurses, which I guess are they going to be full-time nurses? It's only a $100,000 grant. And what would be the specific work they're going to do to prevention? What kind of prevention measures are we thinking of? Are they videos? Are they door-to-door knocking? Are they visits to homeless shelters?
Thank you for that question and for the congratulations. So these will be 2 part-time nurses, and they will be working with our community partners, so including nursing homes, dialysis centers, schools, homeless shelters, other community settings, in providing educational materials and developing those materials, as well as helping do assessments of those facilities, their staffing needs, their education needs, their PPE needs, their infection prevention processes in those facilities. So really providing a lot of education and serving as partners with all of these community agencies, and then again standing up that task force to bring all of our community partners to the table as we work on these efforts.
Thank you. Justin, I think your mic is off.
Thanks. Are there any, thanks, Mike. Any other, thanks, Paul. Any other questions? Kyle, go ahead.
I was just curious about how the July 31st enforcement for Lighthouse changes from what you put out the other week.
I think the main thing is Connecticut only,
Okay.
but otherwise we have restricted the number of cars previously.
Yeah, because right now it should be Connecticut only and New Haven only for walking in. Is that right?
No, unless I'm mistaken. So it's no, I'm not mistaken. It is Connecticut only. So people from Connecticut can use the park, so we're not restricting it to New Haven residents.
Oh, okay, for walk-ins.
Right. So this is a health issue, and then Connecticut right now, there's low cases all around the state. And so people should not be walking in from other towns, presuming that the park is, we're not restricting non-New Haven residents from the park, we're restricting non-Connecticut residents.
Oh, okay. Okay, and then I know back before COVID, it was probably around January or February, the police department started the harm reduction kits, and they had, there's supposed to be a program inside for getting people tracked into getting treatment. With the latest overdoses, I was wondering if that program was continued and if there was any success with that, and if that's something that we might consider given the latest overdoses.
Director Bond, you don't know the answer to that, too?
I don't. I would defer to Chief Reyes on that.
Yeah, we can check on that.
Okay. And then the last question I had was, is there any update on the recent uptick that we saw as far as COVID outbreaks? I noticed that on the heat map, it looked like Fairhaven, still obviously an area that was of concern before, but it looked like the circle was a little bit brighter. And I know earlier this week we had some possible correlation with a church. Wondering if there's any more information about that.
So we've been closely monitoring where we have been for the last 2 weeks. I'm just going to show you an update here. So what you see in front of you, the date range has changed, right? So I reported a certain date frame, so the time frame changes. So if you see here, I'm looking at from 7:15 to 7:28, and you'll see sort of where we are with monitoring the cases. And so we're seeing that it's fluctuating. And so that is why we've been sort of increasing our messaging, just emphasizing to different sectors within phase 1 and phase 2. And we're also monitoring where we're seeing the different age group. And so we are seeing an increase in younger populations. So we have 16 of those 16% are 0 to 9, and 39% are 30 to 39. And in 19%, 20 to 29. So we're sort of closely monitoring that. The cluster is definitely, we saw that it was within the different, but they were not, it did not play a factor in the increases. So it was just sort of spread out. And I agree with you, we are seeing them sort of higher in a little bit in Fairhaven section. And we have increased our efforts in promoting the testing site in Fairhaven Community Health Center, both in English and Spanish, the flyers, so that we can ensure that people, if they become symptomatic, know that there's a testing site right in their local community. We've been also trying to work really hard in increasing awareness on the travel advisory. We're up to 34 states currently. And so we've also increased that messaging. So this is sort of what we've been looking at in conjunction to what the mayor just showed in a different format, so that we can sort of get a better gauge of any potential trends that we need to be concerned about.
Okay. And with the college is going to be returning soon. Any thoughts on how, to continue messaging to those younger populations?
Yeah, so we, in conjunction with Michael Piscatelli from the Economic Development Division, we just conducted a webinar with all of the colleges and surrounding colleges. We also have been working with the local landlords that rent to these individuals and provided some guidance and some updates regarding enforcement and support that we expect from the landlords. And so that was a really proactive meeting. And so I was part of that presentation that just happened this past week, earlier this week. And so we will continue to work with the universities. We have a plan underway. We are also engaging Yale University as the local police there to just ensure that we're working together and just stepping up our task force efforts when school starts.
That's it for me. Thanks.
Thank you. And I saw you at the beach the other day.
Thanks, Kyle. Paul, you had a follow-up question.
Yeah, I'm sorry if I misheard this or didn't hear the answer. So you're saying this younger trending, which we've seen nationally, of course, is the story of COVID. 39, the average age of 31. That
Yeah.
sounds, if I'm not mistaken, dramatically lower than what our earlier press conferences were. Do you remember what the average age was before?
Yeah, so the average age in general for the overall cases since the beginning of this pandemic is age 46.
Mm-hmm. And
So
so
when
that
you,
31 is just the last couple of weeks?
correct.
Wow.
And so we want to continue our messaging of people, really the 3 W's that you've been hearing us is really just making sure that individuals are really wearing a mask and wearing it correctly, watching their social distancing of at least 6 feet apart. And number 3, washing their hands or having hand sanitizers available. And it's really critical that we all have to play a part. This pandemic, we can flatten the curve, but it takes all of us to work together. And so it's important, especially that we're in the summer months, that when people are doing different outdoor activities or private events, that they're really mindful that we are still in a pandemic. And so just to continue to follow those health precautions.
I just want, can I say something about Lighthouse? Because it seemed like there was some confusion there. So there's been a history in Connecticut of some suburban towns having exclusive policies for their public beaches that exclude residents of other towns. And there's been a court case about that being discriminatory. We do not want to have a policy like that unless there's an absolute necessary health reason to do so. Currently, there is no health reason for us to prohibit other Connecticut residents from coming to our beaches. And therefore, we're not going to have a policy that excludes other residents of Connecticut from using our beaches, whether they happen to walk in and somehow get dropped off near the beach and are able to walk in, or whether they drive in. So if there was some confusion in the past about New Haven residents only for walk-ins, that was incorrect. Our policy moving forward is that Connecticut residents can use the beach. There's a maximum of 225 car parking lot. Is that clear? Okay, good.
And the fees will remain the same for that, though?
Correct. All right. Good to see everyone. We'll see you all soon.